Bismillahirrahmanirrahim. What is Steven-Johnson syndrome or SJS or toxic epidermal necrolysis 10? As you can see in these pictures, the rash consists of painful pink to dark red spots that may blister and usually involve the skin, lips, mouth, eyes, and genitals. That is, you can say mucocutaneous this syndrome. Early stage rash, there is flat or slightly raised pink spots with dark red centered spots. Then later on they become blisters and there is peeling skin. Skin becomes peeled off. And typical rash distribution involves the thorax, neck, and then descends down. There is redness, blisters, and erosions of the lips and inside the mouth. And in case of eyes, there is redness, irritation, pain, and erosions of the eyelids and eye. Then this is a sequelae. Non-specific symptoms like fever, malaise, cough, rhinitis, myalgia, prodromal symptoms you can say happens. Then there is targetoid rash, mucosal ulcerations. This is the stage of appearance of skin lesions on the upper body. Upper body पे skin lesions happens. Then in the next stage, spread and progression of blistering, sloughing lesions, large painful erosions, easy sloughing of skin, compromised skin and mucosal barriers. Complications based on the percentage affected surface area. Less than 10% Steven-Johnson syndrome, 10 to 30% overlap between SJS and 10, and more than 30 there is 10. It is basically a fatal skin condition involving the sheet-like loss of epidermal and mucosal tissue, accompanied by other systemic symptoms. Over 80% cases result of an adverse drug reaction. Etiology involves the drugs and infections. Infection involves the Mycoplasma pneumoniae, and drugs involve the sulfonamides, anticonvulsants like phenobarbital, carbamazepine, lamotrigine, and NSAIDs, paracetamol, and some other drugs like allopurinol. Clinically, as we discussed in previous slide, there is influenza-like symptoms, fever, cough, rhinitis, cutaneous lesions, quellis, erythematous macules with pruritic centers, mucosal lesions, and urethritis. Management is supportive and transfer to the burned center as skin epidermis gets peeled off. Lesions start on the face and the thorax. Then this is the ocular manifestations. Ocular manifestations, their treatment. Acute stage में there will be conjunctivitis, conjunctival hemorrhage, topical steroid eye drops only. Then there is conjunctival membrane or pseudomembrane, topical broad antibiotics, mebominitis, preservative-free lubricant, symblephrone, amniotic membrane transplantation, epithelial defect. There is mebominitis, epithelial defect, entropion. These are the changes of acute stage. And subacute, there is entropion, trichiasis, dystrichiasis, symblephrone formation, recurrent corneal epithelial defects, severe dry eye, keratinization of the posterior lid margin. Then chronic stage, meibomian gland dysfunction, MGD, diffuse atrophy, trichiasis, eyelid malposition, punctal occlusion, dry eye, keratinization of the eyelid margins, severe dry eye, corneal opacification, vascularization, ulceration, limbal stem cell deficiency, ocular surface keratinization.